familiar with once you get into your programs. Now, magnesium, not one that we hear a lot about. It's one of those trace elements of the body. It's one that can do lots of things in the body. It can act as like a coenzyme. It can act with ATP, helping ATP get produced. It can help transport. There's a lot of things that magnesium can do. We don't need it in very high amounts in the body, but what we do know, a lot of times we can lose this vital mineral through feces and urine. Okay? So if someone is maybe having diarrhea or something to that effect, their magnesium may be off. And sometimes it's as simple as just getting the supplement. Okay? I don't know if you guys have ever heard somebody say, well, no, usually for the potassium. Now, once again, we can have too much or too little, and this time it's called magnesemia. If there's too little, it's usually because in some way it hasn't been absorbed from the foods that we have taken in. So in the intestines, it hasn't absorbed it correctly. They can be having severe vomiting, diarrhea, or renal disease. Once again, those kidneys. Usually what's going to happen, nerves and muscles are very irritable. They're going to have tremors, spasms, tetanus, high blood pressure. Their heart rate's going to be high. And the problem comes into affecting the ventricles. It's going to be affecting that myocardium. If there's too much, this is usually very rare, except for people who will have renal disease. That becomes a whole different issue. And it's the opposite. Their muscles get weak, they're very lethargic, their breathing is off, they might even go into respiratory failure, blood pressure is very low, and usually the end result is cardiac arrest. Now, the goal is to make sure that we always have acid-base balance. This section of the text is going to go into great detail about how, okay, if we've got the CO2 and then we've got phosphates and this sort of thing. I'm not asking you to know that part, okay, because hopefully the doctors or whatever around you are going to know that part better. What I do want to remind you about is we do have buffer systems in the body. It's basically the bicarb buffer system. It's a solution of the carbonic acid and the bicarb ions. Under normal conditions, CO2 and stuff that gets produced to make the pH of the blood get affected. Our kidneys and our lungs take care of it. They work to maintain the pH. The disorders in the acid-base balance are acidosis and alkalosis. This would be pH of the blood. In acidosis, if the pH of the blood is 7.35 or lower, that's acidic. If it's 7.45, higher than 7.45, they're alkaline. Both are fatal. We can only live for a few hours with our pHs getting but so low or so high. This is one of the reasons that if people come in, like for example, a heart patient comes in, they're getting ready to go into their cardiac bypass surgery. But they may have diabetes. They may have renal disorders. They may have other health conditions that are present. And as they're prepping for surgery, they code. But they're brought back. But now, due to the disruption of the blood flow, they have now gone into acidosis. That means surgery has to be put off, everything has to be delayed because they've got to correct this problem before the surgery can be performed. So they would have to begin to address it because the doctors and hopefully nurses and all the healthcare professionals are going to know that they have to pay attention to these numbers or else that person is not going to live very long. Hopefully the goal of the healthcare professionals is to make sure that the patient lives. You know, hopefully, if there's going to be a quality of life and so forth. So what will happen is, the first things that will take place, my kidneys and my lungs are going to try to correct it. And it's called compensation. So in the case where blood becomes too acidic, too alkaline, respiratory system is going to respond by either increasing or decreasing our breathing rate. And then the urine will either add, what will happen is if the blood's too acidic, it'll let more of the H pluses pass, try to get it out of the body by way of urine, and therefore balance the pH. So these two systems will work very hard to adjust the problem, along with everything that the healthcare professional is doing. So really, this chapter was one that kind of brings together all these little electrolytes and everything that we've talked about. That's pretty much it for 24.